Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. The most urgent. Last week, Michigan governor released an executive directive in response to the proposed cuts by the House Energy and Commerce Committee budget. It would result in cuts to Medicaid with detrimental impact for every aspect of healthcare across the country, especially rural. According to the report, the cut would end coverage for hundreds of thousands of vulnerable Michiganders, reduce access to providers for everyone in Michigan, and raise the cost of receiving healthcare services for all Michigan residents. Though the method and impact of these cuts will likely differ from state to state, this report is representative of what we will see across the country. The report includes a breakdown of each proposed area of cuts of Medicaid and how it will impact Michigan in those respective cuts. For example, reduced federal matching rates will result in 30% of Medicaid beneficiaries losing their health care coverage altogether. And provider tax reform cuts are proposed to cause $3 billion in annual losses. Up to $2.3 billion is in decrease in payments to Michigan hospitals. On the backs of hospitals, providers, and those who are giving the services every day, this proposal has been made. House Republicans reportedly took 2 proposals out of the budget, and their plans of taking those out for cutting Medicaid included the reduction to FMAP, it's called, which is a federal medical assistance percentage, and a per capita caps. While this initially sounds beneficial, the $880 billion in potential required cuts has not been reduced. These cuts will have to be made somewhere. Likely where? Provider taxes and work requirements. We expect to see a vote on these spending cuts occur this week, so stay tuned to next week's news update. But until then, I would encourage you to reach out to your elected officials and let them know that these are devastating actions that they are taking when they eliminate programs such as provider tax and cut deep to the bone of community hospitals across this country. As in our other news reports, we urge our listeners to take that action to defend Medicaid against those harmful cuts and to reach out and let your voice be known. You can go to ruralhealth.us to send a pre-written or even a customized message to those that represent you. Now on to the damage report. Another report from the Urban Institute of the Robert Wood Johnson Foundation shows how 10 states and Washington, D.C. could experience a $468 billion shortfall over the next 10 years if the FMAP floor is reduced because of cuts to the Medicaid budget. The affected populations primarily include children, older adults, and many people with disabilities. The shutdown of the CDC's Healthcare Infection Control Practice Advisory Committee, first announced at the end of March, is prompting predictions of long-lasting effects on many national healthcare organizations. The committee was a source for guidelines for infection prevention, such as hand washing, mask wearing, isolation standards, followed by most U.S. hospitals. Now, the government web pages related to the committee are archived, with no longer providing information, updated reports on any infection control measures. Infection control professionals are calling on the CDC and Department of Health and Human Services to reinstate the committee, but no further action has yet been taken. Now on to our success story. We're returning to Michigan for our success story today. The Michigan Health Council recently published a Michigan Healthcare Workforce Plan supported by the Michigan Health Endowment Fund to implement data-driven solution to long-term challenges in healthcare recruitment and healthcare retention. The strategy includes cultivating interest in healthcare careers for K-12 students, improving access to healthcare education, increasing experienced educational capacity, and exploring other strategies and partnerships to rebuild the talent pipeline. Hats off to the work done by the Michigan Health Council and for the support and funding by the Michigan Health Endowment Fund. Thank you to our sources today for this episode: Becker's Hospital Review, the Robert Wood Johnson Foundation, The Hill, Helio, and Michigan Health Council.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.